Hello, my name is Nathan Coombs. I'm one of the senior breast and general surgeons at the Great Western Hospital in Swindon in the south of England. For me, as a surgeon, patient safety is paramount. One of the ways that we can ensure patient safety is, as a surgeon, considering double gloving as a technique. Indeed, this is a method where we use two pairs of gloves, an underglove and an overglove in our scrubbing up technique. Now more than ever, we are aware of the risks both to staff and to patients from infections. We use PPE as standard practice. Double gloving is part of that in our armoury. Double gloving reduces the risk of surgical site infection. Any infection for a patient is a terrible thing. It would potentially cause a prolonged hospital stay, as well as mean antibiotics, wound infection dressings, and this will be adverse to their recovery. Similarly, double gloving will reduce the risk of needle stick injury for myself or my staff. I find that at the end of an operation, I can remove the outer pair of gloves and still have a clean, sterile pair of undergloves. This allows me to place a dressing onto the patient in a clean way, rather than having to reach for a second pair of gloves, which is inefficient in itself. I can also then handle and move the patient with the other staff, which again improves theatre efficiency. It's all very well using double gloving techniques when you're operating, but the key is actually putting the gloves on properly in the first place to ensure that there is no contamination to either the underglove or the outer glove in the first place. When I first started to wear double gloves, I was concerned that I wouldn't have the tactile feel that as a surgeon I need. But I found that wearing a quality pair of double gloves, actually the feel of the tissues, the tactile nature isn't affected at all. Some people talk about the tiredness and the fatigue that one can get when wearing two pairs of gloves. Again, with practice and wearing a quality pair of gloves, the hand remains in a neutral position so that you're not fighting against the shape of the glove. This means that wearing the glove feels completely natural, and indeed wearing two pairs of gloves feels no different to wearing a single pair. I'd actually say it feels more exposed and less natural wearing a single pair than a double pair. Having scrubbed up, now approach the gowning area. The key thing to remember is the hands are clean, but always keeping the arms vertical so that any dirty water drips off from the elbow. We have two sterile towels. We'll use the first towel to dry just the left hand, and starting with the fingers and the hand, drying down the forearm to the elbow, and then losing the towel. Using the second towel, we do exactly the same, but with the right hand, starting with the fingers, coming down the wrist, forearms to the elbow, and then losing it, keeping the hands upright and being careful not to touch anything else. At this point, we have a gown that's open. The key thing with a gown is you have a clean side, which is the part that will be sterile and approaching the patient. So taking the top of the gown with both hands, moving slightly away from the gowning table, just allowing the gown to drop by holding the top of the gown. Then, using both hands together in a simultaneous action, bring the hands into the sleeves, never allowing the fingers to come out from the end of the cuffs. This is the closed glove technique. We ask the assistant just to tighten the gown up to lift it over the shoulders. I have my undergloves, which are half a size larger. Open the gloves and then turn the gloves around, so rotation. So using my thumb lined up with the glove thumb point, I then take the glove and then use the supination action so that the glove is now sitting on my hand. With my other hand, I take the free edge of the glove and then with a little tug, pull the entire glove over the end of my sleeve. Then, by pulling slowly on the glove and the gown, the glove is then pulled and my hand advances out of the end of the sleeve into the glove. We use a similar action for the right hand. We have our gloves which have been rotated. I then pronate my hand, taking my thumb, lining it up, then supination, then taking my free edge, a little tug, and then the glove gets pulled over the end of the sleeve. By pulling slightly on the gown, my fingers will slowly advance into the glove. We do a similar action when we're putting the second pair of gloves on. Then using the thumb underneath the free edge of the cuff, supination, and then with a little tug, we're able to pass the glove over the hand and just gently pulling on the cuff, you can bring the hand into the glove. Finally, with the right side, supination, a little tug, and so the hand can be advanced into the glove, and just by pulling on both gown and glove, you can make sure that the fingers are comfortable. To finish off the process, we will need to wrap around the gown. So with the assistant taking the free edge of the tie, then rotate. We then pass it around the back and then tie. Now I will explain how to remove gown and gloves in a clean way. First of all, I would ask my assistant to undo the top of my gown. I've already taken my outer pair of gloves off. Then I would take the gown itself and then in a rolling fashion ensure that the gloves and gown remain rolled up in front of me. Then taking the thumb of one hand, I can place that inside the gloves on the other and withdraw the glove and gown. Using the thumb on the other side, I can do exactly the same motion, ensuring that any contamination remains in the gown, the glove, and is placed straight in the bag. For me, double gloving brings efficiencies in the hospital environment. It is a protection for myself and my hospital staff, but also, and perhaps most importantly, it's all about patient safety.